PREMIER trial is a prospective trial of PYLARIFY for patients with favorable intermediate prostate cancer. So PYLARIFY is already FDA approved, but the FDA label for it is for unfavorable intermediate, high, and very high risk prostate cancer at initial staging, because there's no data demonstrating that in favorable intermediate prostate cancer patients, there will be treatment changes or improved outcomes. So this is going to be a multi-center trial to accumulate the data to see whether PYLARIFY PET-CT in patients with favorable intermediate prostate cancer has the same improvements in patient management that we see in unfavorable intermediate, high, and very high risk prostate cancer. So we open the trial at the Hoag Family Cancer Institute. It will be opened in multiple additional sites over the next couple of weeks to months. And we're very happy to be able to open this so that patients with favorable intermediate prostate cancer, which is a large percentage of patients at their diagnosis, now have access to PYLARIFY, where previously they didn't have access as there was no insurance coverage for it. Pluvicto is currently the only FDA-approved PSMA-targeted radioligand therapy for patients with prostate cancer. There are multiple other PSMA-targeted radioligand therapies that are in clinical trials. One of them is the lutetium PNT2002 molecule, which was evaluated in the phase 3 SPLASH trial. SPLASH has fully accrued and the data is being analyzed. The publication is not out yet, and this will almost certainly be going to the FDA for approval as a second FDA-approved PSMA-targeted therapy. While people are waiting for the final data analysis and FDA approval, the only way for patients to be able to receive this medication is on what is now called the Expanded Access Program, where Lantheus is providing the agent free of charge, without having to go through insurance, for patients who have progressed on androgen receptor targeted therapies. So Pluvicto is available for patients. The FDA label has it available for patients who have had androgen receptor targeted therapies and taxane chemotherapies. The PNT2002 EAP provides PSMA-targeted therapy right now to patients before taxane chemotherapies. They only have to have had exposure to androgen receptor targeting agents.